Here's an example in terms of cervical cancer, a screening program, where the ad was literally written by the research we did with women, they would talk about excuses of why they haven't had a pap smear, and simply by showing those excuses back, it created a motivation that the consequence of not doing that was significantly greater than the discomfort of doing that.
Last year in Australia, this many women, just like you and me, died from cervical cancer. Most, however, had a perfectly good excuse.
Look, I don't have time for a pap smear right now.
I don't have any symptoms.
I know I should go. Oh, I'm too old.
I've only ever had the one partner.
Some women find the idea of a pap smear embarrassing and uncomfortable, but one pap smear every 2 years will help pick up any early changes.
All over. So we'll see you again in 2 years.
Up to 90% of cases are now preventable. So all women aged over 18 who have ever had sex should have a pap smear every 2 years. Because if one thing could be worse than dying of cervical cancer,
I'm too busy to go to the doctor.
it's knowing how easily it could have been prevented. Cervical cancer. Don't make excuses. Make an appointment. Authorised by Chris Ellison for the Commonwealth Government, Parliament House, Canberra.
Okay. That was an ad where there were, you just said vignettes of women coming up with excuses, basically, and then the resolution was simply the consequences are much greater than that. And again, there was a very positive response to that. I'll try and go to the next slide.
Every cigarette is doing you damage. This is part of an aorta, the main artery from the heart. Smoking makes artery walls sticky and collect dangerous fatty deposits. This much was found stuck to the aorta wall of a smoker, age 32. Every cigarette is doing you damage.
The most successful tobacco control campaign, social marketing component in Australia's history. John showed a figure there of what happened in the 1980s. That's when I first started working in social marketing, 1983, in the first Good for Life campaign in New South Wales. Those campaigns came in, and Victoria and other states came on board too, and we saw this significant shift. By 1995, things had really levelled out, and when this campaign came in, they just did that plummet again. This was an example of a campaign which was again using negative, like fear arousal, driven by the research from talking to smokers. At any one time when you speak to smokers, around between 2/3 and 3/4 will say they'd like to give up now if only you could basically tell me more, give me more reasons why I should quit now. And this was very much developed in response to smokers' desire for more and more graphic reasons why they should quit. But I just take you through those to just again, reminder of different sorts of appeals for different sorts of issues with different sorts of objectives. During the 2000s, many more campaigns on there, including where chronic disease has now become much more on the public health agenda, fruit and vegetable consumption, physical activity levels, focusing on overweight and obesity. In doing some research in this area, in preparing for this presentation, I came across this bulletin there, from the National Child Protection Clearinghouse, which was a review on looking at are social marketing campaigns effective in preventing child abuse and neglect. And the conclusion was reached there was that future social marketing campaigns that aim to address child maltreatment need to be empirically informed, designed with a theoretical foundation, rigorously evaluated and embedded in wider community strategy for the benefits of child abuse prevention and effectual interventions to be achieved. I thought this was a great intro because this pretty much covers off some of the key elements of what is best practice social marketing. So let me take you through some of those now. The fundamental aspect when we're taking a social marketing approach as opposed to an expert-driven approach is that we need to be viewing the issue that we're going to target through the eyes of the target audience. And again, this is just as applicable in terms of child abuse prevention, crime prevention and community safety. And what I want to focus on here is that the principles involved in whether we're creating a television commercial like you've just seen there, or you're creating a poster in a remote village, which is on a pathway that people will see, the principles remain the same. We need to understand, not from our health expert point of view or crime prevention expert's point of view, but how does the people that we're going to communicate with and engage with, how do they see the issue? recognising that people will only accept what we are promoting or trying to facilitate if they believe the benefits delivered by that behaviour change justify or outweigh the costs. And we'll talk about what those costs might be. Nothing that we are going to do in an area like crime prevention or in health is going to operate in a vacuum. We need to understand thoroughly the problem that we're dealing with, the external environmental analysis. Who are the people that we can be can be working with? Who are our competitive influences here? The sorts of things that sorts of influences John mentioned as well. And what sorts of resources? What approval process? What are the constraints within which we're going to develop this program? We need to understand that our target audiences aren't just one homogeneous mass. There are many different sub-segments within audiences that we're going to deal with. We need to apply principles of audience segmentation and analysis, breaking down into smaller segments and really understanding them in detail to be able to have an engagement that is going to be meaningful with them. We use formative research very critically. Again, it's not a matter of talking to an advertising agency who's going to come up with a smart idea for a poster or an ad or something. There is a very clear strategic process that we go through. We talk about developmental research, to go out with that target audience, talk with them, walk in their shoes for a period of time until we understand how they see this issue, what's important to them, what are the motivators, what are the barriers for them. When we're developing ideas, we go through a process of concept material development research where we take ideas to samples of the target audience and get their response to it. Look at what we're trying to say from their perspective, not just ours. And then finally, when we're creating actual communication materials, we pre-test them to make sure that not that it's got our messages in there, but that the way the target audience receives it, pays attention, engages with it, is consistent with what will achieve the specific communication objectives that we've set and that we've set because of what we've understood in developmental research of what needs to happen. Channel analysis, understanding where our target audience lives, works and plays, and be able to understand how we can be active in those environments. Not just what media channels they engage in, but where do they live and what do they do and what do they like to do. The sorts of environments that John was talking about again in terms of clubs and that can be very important places for the intervention to really understand the nature of influences and be part of that. Strategy formulation grounded in appropriate theory. A lot of people have done a lot of work in understanding what works and what doesn't work. And what we do in terms of social marketing is to clearly learn lessons from those sorts of experience and those sorts of theoretical frameworks. And we don't have time to go into a whole lot of those frameworks now, but you can boil down a lot of fundamental principles from models like the health belief model, social cognitive theory, theory of reasoned action, theory of planned behaviour, which have all been validated in terms of being able to predict behaviour change, to come down with some core principles. And these are the sorts of core principles that we would really need to look at in terms of health, someone taking preventive action. What we say is in conjunction with addressing structural barriers to change, because it's no good saying, trying to get people to eat healthier food if that either food is either not available or it's more expensive than people can actually afford to pay. So we need to acknowledge the structural change, and that's where policy interventions become very important to facilitate the behaviour that we're trying to promote. But we need to generate a sense of personal relevance of the issue. This is about me. This is relevant to me, not just an idea that someone's sent a message to somebody else. There's a sense of urgency to take action now. It's not I'm going to give up smoking when I'm get married or when I'm pregnant or when I'm 30 or when I get a new job or all those. We're very good at deferring those sorts of decisions, but it has to be able to generate a sense of I'll do this is important for me to do now. Importantly, we need to believe that the action being promoted will be effective in achieving the desired outcome. We refer to this as response efficacy. I need to believe that what you're telling me to do will be effective in whether it's reducing my risk of assault in crime prevention sort of intervention or my risk of burglary or whatever. I need to believe that this thing is going to work. I also need to believe that I'm capable of undertaking what you're asking me to do in terms of achieving that. We call that self-efficacy. And we need fundamentally to believe that the outcome justifies the efforts required to undertake the promoted behaviour. Now, unless we're serious about understanding the perspective of the target audience on these sorts of issues, we can just be left with sending interesting messages, making nice pamphlets and posters and feeling like we're doing something. But unless we really engage in this sort of thinking, we can be simply a wallpaper. We need to facilitate an exchange, and this is what marketing is fundamentally about. Facilitate the exchange through social marketing by considering the fundamental, and this is the simple sort of structure here, of product, price, place and promotion. Now what does that mean? In terms of product, we need to be really clear what it is that we're actually offering the target audience consumer and how can we increase the perceptions of the values and benefits of that. What are we really promising in what we're trying to do? What are the costs that we're asking someone to actually pay? Now, we heard from Deputy Commissioner earlier about people being asked to lodge complaints about family violence and situations like that. But we really need to understand what's the cost of doing that from someone. That's a very, very serious behaviour to undertake, and we need to be able to support that behaviour. We need to be able to promise that there are real benefits that will be emanate from that behaviour in order to facilitate a perception that yes, that's worth something. That's something that I need to do. But we need to understand how hard is it that we're asking people to actually the behaviour we're asking people to undertake. Place is very important, considering the influence of settings, and I'll talk about that a little bit more later on. Where is the behaviour exchange that we are talking about going to take place? And in community safety, this is obviously a very important area. It was interesting, the perception, David Chalk, about police. A place consideration, and I live down at Coogee Beach in Sydney, and a very popular venue for Australia Day activities. And it really struck me. I was just down there for a swim early morning with my 18-year-old son, and the police were out and about in a very positive way, and their presence was so obvious that anyone who was going to sort of muck up knew that it just wasn't going to be tolerated. But it was a very positive police presence there that preempted the problems that may otherwise have occurred if it had been a matter of police not available and then just coming in when there was a problem. A very strong place consideration in terms of that intervention. And promotion. How are we going to promote this offering in terms of face-to-face, mass communication, other sorts of interventions. Branding and positioning considerations. Who is this message seen to be coming from, and what do I think about that organisation or that presenter? Very important in terms of the way a message is going to be processed. And process and outcome evaluation. Very important to have the evaluation in place to not only understand how effectively your program's been implemented, did people actually see it, did it reach it, how do they respond to it initially, and then of course did it actually achieve the goals that were set through evaluation. So in a marketing process, we see this as a cyclical sort of behaviour, a cyclical process from analysis, planning, developing, implementing, assessing and then getting feedback. And research has a critical role to play in understanding the audience before we plan, concept development in terms of developing, benchmark or baseline study before we implement, process evaluation once it's there, and then outcome evaluation, and then finally an analysis stage of saying, well, what did we learn through that cycle of activity? What can we do better next time? And this was operationalised in a 12-step model, and that was something that Peter Hommel and I then put in that Trends and Issues paper. And what I'll just quickly go through that and just sort of give some examples there. Problem analysis that we've talked about. What sources of data are available to assist in gaining a thorough understanding of this issue? In which population groups is the problem greatest? What trends are evident in the increase or reduction of the problem with particular subsegments? What are the primary harms associated with this issue? And what are the primary factors, the facilitators and barriers contributing to or influencing this problem that I would need to develop strategies to address? External analysis, understanding the environment within which the intervention is going to be implemented. Who are the stakeholders and influencers I need to engage with? Where can I create effective partnerships in what I'm doing with government, non-government organisations, private sector? You know, is there a really well-accepted brand that I can associate with, it's an appropriate fit to what I'm doing, that already has strong allegiance by a particular subgroup of people that I'm trying to deal with? Recognising the existence of potentially competitive or antagonistic influences. And again, John referred to some of that in terms of communication message about responsible or safer use of alcohol is operating in a barrage of messages about drinking alcohol.